Welcome to Doctors on Call. I'm Jenna Miller. Staring at a computer monitor, tablet, or phone for hours on end has become a part of the modern workday and lifestyle. And inevitably, all of that staring can put a real strain on your eyes. 70% of all Americans experience eye strain that can not only be uncomfortable, but have an impact on workplace productivity. Taking care of your eyes and your health is the first step to preventing vision loss from common eye problems as you strive to maintain healthy vision for your lifetime. Eye care is our topic on Doctors on Call today with Dr. Stacey Jones.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Stacey Jones is a therapeutic optometrist born and raised in Northwest Kansas. After graduating with honors from Kansas State University in Manhattan, Kansas, Dr. Jones went on to obtain her Doctor of Optometry at the University of Houston College of Optometry in Houston. She completed a rural family practice externship at York Eye Associates in Gainesville, Texas, and an ocular disease rotation at the Eye Center of Texas in Houston. While at the University of Houston, her emphasis was in ocular disease management and pediatrics. She is a registered dietitian as well as a diplomat of the American Board of Optometry. Dr. Stacey worked for Kendall Krug OD in Hays, Kansas for more than 15 years before opening EyeSmile Vision and Dental in January 2019 with her husband Jared, who is a dentist. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding eye care on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or optometrist. Let's go ahead and get started with some questions of our own while we wait for those phone calls to come in. Thank you so much for joining us. First of all, let's talk about how often you recommend an eye exam.
The American Optometric Association, which is the organization that overrides everything we do as optometrists, really suggests an annual eye exam for the majority of people. Occasionally we can go a little bit longer than that if we have someone who's healthy, but certainly at least one every 1 to 2 years, sometimes sooner than that.
Sure. Now, can that annual eye exam detect warning signs of health problems and disease?
Absolutely, yeah. And every time we do an eye exam, we're looking for beyond the eye health, we're looking for things like diabetes, sometimes heart disease, macular degeneration, and things of that sort. But we're always doing a screening for those sorts of things when we do the full eye exam.
Sure. How important is it for a child to go in for their eye exam, or should a parent look for some warning signs?
Sure. We certainly recommend children be seen in the first between 6 months and 12 months typically. I know that seems really young for a lot of parents, and that seems surprising, but we're always looking for anything that may be present at that early age, and then we do recommend children be seen again between the ages of 3 and 5. If at any time in between then a parent notices any concerns with maybe there being an eye turn, or maybe the child is not developing in a way that they think, then we would certainly see them before that. But starting at 6 months, we like to see little ones starting at that age.
Excellent. When a person comes in for that initial eye exam, what can they expect?
For their initial eye exam, we really divide that eye exam into 2 parts. There's a pre-screening part, oftentimes worked up by a technician, where we're really looking at the vision piece. I think a lot of times when patients come in, they think that that's really what we're checking is, can they see 20/20, and if not, how can we get them to see 20/20? So there's certainly that aspect of vision, but the other piece is certainly the health piece. So sometimes that is through a dilated eye exam or photographs, different additional testing, but we're always looking internally to see if there's any sort of disease process going on. So every exam is really twofold from the majority of patients, unless they're coming in for a specific problem.
Okay, let's talk about vision therapy. What is that?
Vision therapy is really defined as just very basically like physical therapy. I think a lot of people can understand what physical therapy is because it's more common. But vision therapy is really looking more at the neurosensory piece. So neurosensory, neuromuscular pieces of the eye in general. So it goes beyond the traditional vision that we know it, correcting 20/20, but helping the eyes to work better from a muscular standpoint. Maybe the eyes aren't tracking or aligning well, as well as maybe somebody post-stroke or post-head injury can have some issues as well. And so just really rehabilitating more from a perspective of physically rehabilitating the eyes and their movement together.
Sure. Now, how does a vision therapy session differ from an eye exam?
I think that's a great question. Typically in an eye exam, we are just going through all those components that we mentioned earlier. A vision therapy exam is going to look more at the neurology as well as how the muscles of the eyes work together. So there's a lot more steps to that exam, looking more at how the eyes are tracking, how they're working together as a team, as well as looking at maybe some different behavioral type issues that patients may have. We can also do some more developmental type issues as testing as well. So if a patient may have some developmental concerns or maybe some learning difficulties, then we're going to be looking a little bit more at those things as well.
Sure. And how long does a vision therapy session typically last?
The exam itself is probably typically somewhere between 60 and 90 minutes, so it's much more in depth and we're collecting a lot of information in that time. If it's decided that a patient does need vision therapy, then we'll usually do anywhere from 12 to 30, maybe 40 weeks of vision therapy in office once a week, and that's coupled with home therapy just to work on any integration that we need and reinforcement we need at home as well.
Okay. Who might be a good candidate for vision therapy?
Oh gosh, we see all sorts of different ones. A lot of times children are being referred to us if they have a lazy eye, also known as amblyopia. So if they have one eye that's strong and one eye that's weaker, that would certainly be an example. If we have a patient who has an eye turn, whether that's turning in or out, and we're trying to rehabilitate and get the two eyes to work together, that would certainly be a reason. But a lot of times it's just a child who's struggling to read and not learning well or not able to learn to read. And so sometimes it's something very simple as just teaching them how to track better, follow the words on the page a little bit better. We sometimes will see a patient post-concussion. We're seeing more and more information coming through after concussion, and almost 50% of patients who have had a concussion will have some sort of vision disorder. So they're struggling with headaches, double vision, just having a hard time with the sensory issues of going into a lighted room. And so I think a lot of times they are maybe dismissed to play or even go back to school after a concussion, but their eyes still aren't working well. And so we do work a lot with those patients. Additionally, patients post-stroke or injury of some sort in that way, we can work with those patients as well.
Very interesting. We are going to go to the phone lines now. We've got Sarah on the line from Salina. Hi, Sarah. Go ahead with your question for Dr. Jones tonight.
Hi. You were talking about helping children who are struggling reading, and I was wondering if you test for dyslexia.
I don't specifically test for dyslexia. I think there are some things that can be teased out during our examination time. Most often, dyslexia takes several different rule outs, and so If we're looking at a child who maybe is having some issues with reversals or misunderstanding in that way, then a lot of times we would refer them further down the line for further testing. But a lot of times vision therapy can certainly help someone who does show signs of dyslexia, or maybe that can be teased out as something different. But for me to specifically do testing for dyslexia, I don't do that.
Okay. Now you had, before the phone call, you had mentioned about the concussions. How does the concussion affect the vision?
Everybody kind of presents a little bit differently, but in those patients who do suffer, you'll hear things like things become very blurry as they're trying to read, or they just can't concentrate. They are very overstimulated by lights or a lot of activity going on. Noises can sometimes be an issue. But a lot of times it's just maybe that they have some double vision and their eyes just aren't working right. And the interesting thing about concussion versus a child who is born that way is that they know that something's not right, but they're just not sure how to maybe to get those words out in a way that makes sense. And so they a lot of times just feel like maybe this is their new normal and that they have to kind of suffer through it. But it can be something as simple as a headache that is ongoing. But what I've seen lately in the patients that I'm working with is a lot of times they just are really struggling to read and to keep things clear on a page and to get through a day. And by the end of the day, they're just so exhausted that it's hard for them to function normally. And so if we can get them rehabilitated in a way, and a lot of times it's not just me doing vision therapy with the therapist, but sometimes it's a collaborative effort by physical therapy, working on some vestibular issues and balance and that sort of thing to try to really get them feeling better and functioning more normally.
Sure. Okay, we're going to go back to the phone lines now.
Okay.
We've got Darlene on the line from Hoxie. Hi, Darlene. Go ahead with your question for Dr. Jones.
Are you an eye doctor?
I am. I'm an optometrist.
Okay. I have been told that I have Fuchs dystrophy, and nobody's given me any guidelines how to take care of it or watch for things. So do you have anything for me on that?
Sure. I think there's probably many questions. The first question would be, have you had an eye exam recently, and is it being followed closely by your own eye doctor?
Yes, but he doesn't seem to know much about it. And I had cataract surgery, and that's where I was told that I had it.
Okay. Fuchs dystrophy is an inherited disease oftentimes, and depending on how progressive it is, it can cause some clouding of your cornea, clouding of your vision, and so sometimes if it's a real mild form, you may not have any symptoms at all. There may not be anything you can do, but as it progresses, sometimes it can create much more blurry vision to the point where if it's not something that can be easily controlled through certain drops that your eye doctor may recommend, there's a certain kind of drop that you can use that really kind of dehydrates the fluid that's within the cornea that's creating the blurry vision. If over time that's not working, then eventually it can lead to a surgery that would require the replacement of the cornea. But for the most part, I would say that it would make sense that if you're not getting the answers that you need from your doctor, to maybe seek a second opinion from someone who maybe can get a closer look at that and offer some suggestions based on what they are seeing in your eye.
Do you have someone you can recommend for a second opinion?
At this point, I think it probably just depends on your symptoms, but I would say a cornea specialist. The closest cornea specialist that I know of is in Wichita right now, but I think if you just call around and look for an optometrist or even an ophthalmologist close to you, they would be able to take a look and recognize it if you make that note to them that you'd been told that you have that, and then if they feel like you need to see a cornea specialist, then you can certainly be referred on for that evaluation.
An ophthalmologist in Hayes?
An ophthalmologist, yes, we have 2 ophthalmologists in Hayes. We have Dr. Pokorny, who is in Hayes Medical Center, and then we have Dr. Holwiger, who practices general ophthalmology in Hayes, and then we do have several optometrists in Hayes who would be very capable of taking a look as well.
What's the name of the one in Hayes Medical Center?
Dr. Pokorny, John Pokorny.
How do you spell that?
Oh gosh, I think it's John Pokorny, Pokorney, I believe is how you spell his last name.
Okay, excellent. Very great advice. We're going to go back to the phone lines now. We've got another caller waiting to ask a question. This is Bob on the line from Salina. Hi, Bob. You are live on Doctors on Call. Go ahead with your question.
Yes, I would like to know if I usually at night when I sit down and try to read a book or something, my eyes are watering so bad, and I can't even read the words. And sometimes it happens in the daytime.
Okay. Gosh, there's so many different ways and answers I can think of as I'm thinking about watery eyes. There's a lot of different reasons why our eyes can be watery. Sometimes it can be strangely because of dryness. It seems odd that your eyes would be watery if they're dry, but a lot of times you can have reflex tearing. So if your eyes are especially dry, it can be a response of your eyes telling your brain that you just need a little bit more moisture. So that's certainly a possibility, but there's a lot of other things that could be going on, and I'm not sure without you being seen that we would be able to really give you good advice on why that might be happening. But I know that can be really frustrating, and I think you'd have to see your eye care provider to really tease out what exactly is going on there.
What kind of eye drops do you recommend?
For dry eyes specifically? Yeah. Oh gosh, I say any kind of lubricating drop. My favorite drops are ones that are non-preserved. Okay. But there are several really good drops out there that do have some preservatives. Specifically, I really don't love the drops that are made to get the red out. Sometimes there's some medication in those that just create a perpetual problem. But any of the general lubricating drops that are made specifically for dry eyes, I think are really good. I think with that being said, though, dry eyes are becoming a much more complicated diagnosis. We used to think that it was just because of evaporation or because we worked under fans or we lived in a dry environment, or we could blame it on hormones or any number of things. But we're learning more and more that dry eye is the result of inflammation in many cases. And then there's also more and more research showing that just like we carry the biofilm on our teeth that requires us to brush our teeth twice a day, we carry a natural biofilm on our eyelids that cover the oil and the mechanisms that help us to protect our eyes. And so there's just so much more that we're learning about eyes and dry eyes that sometimes if lubricating drops are not helping the situation, then we may need to look a little bit closer into what might be creating the dryness.
Interesting. What about artificial tears?
So artificial tears are really just another name for lubricating drops. Okay. And so again, I think the answer to that is there's probably not any one brand that I could recommend. I think sometimes we just find that lane that we love and we go with it, and sometimes it means trying several different ones. But artificial tears and lubricating drops are really used as to mean the same thing.
Sure. What is a cataract and how do they develop?
A cataract is basically the clouding in the natural lens of the eye. So if you're thinking about the anatomy of the eye, right behind the pupil sits a natural little lens that carries a prescription very similar to the prescription we carry in our glasses. And over time, that clear lens becomes cloudy as a result of getting older, being exposed to maybe different medications or disease states, as well as sunlight. We know that all of those different things can create the development of cataracts. And so as that lens gets cloudy, the actual seeing part of the eye, which is the retina at the very back of the eye, is trying to see through a cloudy lens. And so hopefully that answers your question.
Yeah, absolutely. What does a person do when they have developed them?
Well, I think a lot of times patients will be aware that their vision is becoming much more blurry. Sometimes they'll complain of glare, or especially glare when driving at night, looking at headlights. And so I think it's important just to have your eyes evaluated by an eye doctor, and then eventually once you reach a certain stage of cataract or a certain visual acuity, then you would be referred for cataract surgery to an ophthalmologist who would perform that procedure.
Okay, we're going to go back to the phone lines. We've got Jessica on the line from Great Bend. Hi, Jessica. Go ahead with your question for Dr. Stacey Jones.
Hi, I don't wear glasses, but my mom thinks I should wear blue light protection when I'm on electronics. How important do you think that this is?
Did you catch that?
I didn't catch
Okay,
it.
we're going to have you repeat the question. You were cutting in and out. Can you repeat the question, Jessica?
Yes, I don't wear glasses, but my mom thinks I should wear blue light protection when I'm on electronics.
Okay.
How important do you think this is?
Yes.
Here we go.
I get that question a lot, and I think there's a lot of marketing regarding blue light glasses, and I think that's a very good question, and I thank you for bringing that up. I think in general, it's really hard to say how much the blue light glasses are going to be helpful, as much as maybe just taking a break from screens in general. I think many years, maybe not that many years ago, but certainly in the literature, if you look at the research in around 2014 and 2015, a lot of our electronic devices that we were looking at that time did not have blue light protection. I think if you look now, a lot of our computers and our tablets and our phones do have some of that blue light blocker and some of those things built in. At the time, blue light wasn't as much of an issue for our eyes necessarily, or the health of our eyes, as much as it was in kind of disturbing some of our sleep. There was a lot of study going on about that sort of thing. So I think the question then becomes, do the blue light glasses help? And are they protecting us in some way? And I do think that for some populations, people who maybe suffer from migraines or who may struggle with some light sensitivity and things, I do think the blue light glasses are helpful. And I certainly think they're not harmful for anyone who finds that they can benefit them. On the flip side, though, the American Optometric Association came up with what's called the 20-20-20 rule, which is truly we're all just spending way too much time on electronics, and that fatigue and feeling that you get after being on an electronic for too long is just that. We are just struggling to see as a result sometimes. And so the 20-20 rule is giving yourself a 20-second break to look 20 feet away every 20 minutes. And I think sometimes if you can do that, that can certainly help as well. So I thank you for that question, because I do get that question an awful lot.
Yeah. Right now, the coronavirus is on everyone's radar. Let's talk about are the eyes a source of contamination or transmission?
Yeah, I think that's the million-dollar question, but I think we know enough now. There's been enough research now that most of the studies coming out of China and even Italy are telling us that there's a very low likelihood that the virus is actually carried in the tears. However, you've heard a lot, I'm sure, if you've been reading and listening about just making sure we have consistent hand washing and being really careful about touching any part of our face. The virus is actually spread through the mucosal membranes. So whether we're getting that through touching our mouth or our nose or even our eyes, then we can certainly be infected that way. So I think the really big question for most patients is, am I going to be able to spread it through my tears? And the likelihood of that is no, unless you have a conjunctivitis or a viral pink eye that's related to having the coronavirus. In very few patients, we know we're probably going to get that kind of conjunctivitis, but if they do, then it's very possible to be able to spread it that way. But beyond that, if you have just sort of the upper respiratory issue, you're probably not going to be spreading it through your tears.
Okay, we have just a little bit of time left. Let's talk about general eye care and what a person can do to preserve their eyes, their vision, if you will.
Yeah, gosh, I think just thinking of the eyes as a piece of the overall health of your body. We are constantly talking to patients about how important it is just to maintain your overall health. And that, of course, carries into the eyes. So if I have a diabetic patient, for example, or someone with high blood pressure, a lot of times when I look at the retina and the health of the eye itself, I get a pretty good picture of what your health is overall. So I think it's really important, just as you're maintaining your heart health and your lung health and your overall physical health, is to do all the things you're doing in the same way. So eating well, getting good rest, exercising, I think those are all very important to keeping your eye health in check as well.
Excellent. Thank you so much for being our guest tonight on Doctors on Call. Is Dr. Stacey Jones from EyeSmile Vision and Dental in Hayes. On our next Doctors on Call, our topic will be the coronavirus. You can email questions for our next program. That address is doctors@shptv.org. And thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.